I swear, if one more article tells me to listen to my body and contact my normal healthcare provider who's not an athlete for strength training guidelines, professional athlete strength training guidelines. Most women have no idea it's not only safe, but also recommended to strength train during pregnancy. And where do those limitations and myths come from when it comes to resistance training for pregnant women? So make sure to watch until the end, because I will be citing studies all along the way that will probably be useful and relevant for you if you have trained with the barbell, trained in the gym, trained with the dumbbells, or if you are considering starting because the doctor told you should exercise and you're like, well, I'm pregnant, I have no idea what to do. My name is Katya, I'm the vegan powerlifter. Let's do this. I have run out of space to roll my eyes. It is absurd how many resources on the internet caution women to not lift over 20 pounds, not pick up the weight that is below their knees. How do those people live life? How are they going to lift their toddlers? Pick up a stroller and put it in the car and go grocery shopping if you are a single mom. We're going to dive into some research today. I've been delaying this video to get more and more extensive information on lifting while pregnant. Stuff is updating constantly, and like everybody has told me to watch Meg Squat's videos. They are kind of dated. The research that I'm going to cite today is, I don't think it was available then. So maybe somebody will make like an update on this video a couple years later when they're getting ready to become a mom. In 2023, I super regret I haven't contacted her because she lived right next to me in North Carolina and did research there. Christina Prevett has conducted the only study on women who have trained up to 80-85% of their 1 rep max. There were CrossFitters. There were 679 people who lifted at least 80% of their 1 rep max repetition during pregnancy. And the research was extensive enough to conclude that those individuals did not have any significant pelvic floor prolapse issues compared to the non-lifting women. They did not have any postpartum complications that were different from the non-athletic women. Again, everybody had complications, okay? So one friend of mine read the article and she was like, they still had complications. Can't you see that it said 66% of the athlete had no complications? Yes, I can see that. Women have complications after pregnancy. Shocker. It's a huge stress to the body. So everybody's going to have complications. The thing that we're comparing is whether they have more complications than non-athletic women. That is all we're comparing. Individuals who have engaged in heavy prenatal resistance training had typical prenatal and pelvic floor health outcomes, the study says. They were not altered when the athletes engaged in Olympic lifting, Valsalva maneuver, or supine weightlifting, or lifting weights when they were laying down on their backs. Participation in Olympic weightlifting and Valsalva maneuver. For those who don't know, Valsalva maneuver is when you kind of inhale, hold your breath while exhaling against a closed airway, a closed throat and mouth and nose, while pushing the heavy weight. For example, when getting up in a squat or in a deadlift, or in a push-up, you can do it in any exercise, but it's this internal pressure inside your diaphragm that you create to help yourself push the weight. So that's called Valsalva maneuver. Participation in Olympic weightlifting, Valsalva maneuver, and acute or prolonged supine weightlifting during pregnancy are cautioned against. True. However, these recommendations are based on expert opinions as opposed to empirical evidence. Also true. So many doctors kind of apply the better safe than sorry mentality to lifting during pregnancy because it's hard to research on pregnant women. Everybody's afraid to get sued. There's not enough pregnant women who are athletic enough to participate in those studies. So I'm super impressed by Dr. Prevett, who has managed to get funding for this, collect all these women, and monitor them while they were doing such heavy training during pregnancy. Like, this is just beyond awesome, and I wish more studies like that come out. It's available for free on PubMed. I'm going to leave some links in the description and also on the veganpowerlifter.com blog. I have a blog about this, citing Christina's study and a few other studies that I'm going to talk about here. Before stumbling upon Christina's study, I checked out the APTA Pelvic Health, or the Academy of American Physical Therapy Association, for pelvic health, they have pictures like this on the covers of their information for how much women should lift during pregnancy. So as a trained athlete, immediately I'm like, I wonder what kind of advice they're going to give. Dr. Prevett is a CrossFitter, and she has competed in powerlifting, and she has ran marathons in the past. So she's an athlete. So I will trust an opinion of another athletic female over a non-athletic female, if you know what I mean, even if she has more education on pelvic floor health. If she doesn't know what heavy strength training is like and what that entails, and how athletes learn to keep themselves safe during heavy resistance training, I'm not sure we can speak the same language. Let me know if you agree or disagree in the comments. Especially now, like that I'm in Russia, I've kind of stepped back from trusting doctors as blindly as I used to in the US, because in the US you assume like, okay, they've had a lot of education, they've had a lot of practice. And here, like, you encounter doctors who still use whatever they used to be taught in their Soviet college 40 years ago, and they're still practicing. They might be great doctors in whatever the one discipline that they're practicing in. But if they are a therapist and they're advising you, or let's say even if they're an OBGYN, and they're like, oh, you're vegan, you should eat meat while you're pregnant. And they're like, oh, you should stop training while you're pregnant. And I'm like, you're a fucking OBGYN. What are you talking about? And I'm asking why? What do you have to back your recommendations? And she's like, it's just bad for you. Or it is known, like in the Games of Thrones.
It is known. It is known.
It is known, Daenerys. It is safer than we used to believe to lift during pregnancy. Of course, nobody's maxing out. Of course, nobody suggests overheating. Of course, nobody suggests dehydration or going close to their heart rate limits. But I think going up to 75% of your 1 rep max should be safe. That was kind of my guideline, and I only scaled down when it has become physically inconvenient to lift those weights. So I've just published a video about my first trimester when I started from relatively low weights, and then I kind of worked my way back up to about like 65 to 70%, 75% 1 rep max on all of the movements except for bench. Bench was higher because I did not have any belly pushing yet. The baby was like the size of a raspberry and an apricot and an avocado. So you don't notice any pushing. There's nothing in the way of your arch. There's nothing in the way of my arch until like the, I don't know, month 4. I will tell you the rest about what I swapped in my second trimester video. So make sure to subscribe and like this one so you don't miss the second trimester updates on my exercise routines. Jumping back, Academy of American Physical Therapy Association, not sure if their advice was relevant for the athletes. I also have not found the babycenter.com information relevant for the athletes whatsoever. So it is important to say that the NOSH graphic that has been published with guidelines on how much you can lift while pregnant and these 20 pounds requirement and not bending, not picking up any weights below the knees, those have been developed first. They've been developed 29 years ago and not updated since then. Second, they have been developed for women at work who still work while pregnancy. So during our wonderful capitalistic, driving to imperialistic society, especially in the US, those are very important guidelines to have in the workplace just to make sure you don't make pregnant women who are all kinds of different women, athletic, non-athletic, anybody older, younger, to not lift more than they should and to not injure themselves. And those requirements should not be applied to trained athletes. And you should definitely not look at them and be like, yes, exactly. Guidelines for me. If you have a non-complicated pregnancy, if you are a relatively young and strong person, you can probably lift more weight. You can be a larger woman versus a smaller woman. If you weigh 135 pounds versus 200 pounds and are taller and broader shoulders, broader hips, you can lift a different amount of weight. Why do we shove everybody in the same box in terms of how much they can or should lift? There are definitely minimum safety and maximum safety lifting, I guess, guidelines, limits, like I said, for workplace, but not applicable for gym. Not applicable for athletic training. If you have been at work for 8 hours, day in and day out, period, no period, pregnancy, no pregnancy, it is important to have some safety guidelines so that you don't injure yourself. Also, a lot of jobs you don't like super warm up for. You don't really prepare yourself for. You kind of just go in and get it done and you go home. A lot of people don't care about the warm up and the cool down if they're carrying loads at work for some reason. But in the gym, usually people with an active life position who care about their bodies and care about their health go to the gym, and they go there on purpose. They take their personal time to go to the gym, and they make sure, usually, they make sure that this is the environment to contribute to your health and not to take away from it. So I would say you have to be pretty stupid to get injured in the gym versus at work versus anywhere else, pregnant or not. Again, argue in the comments if you wish. Now we're going to some interesting studies that I also kind of stumbled upon and got excited, but they mean nothing. For example, resistance training does not decrease blood flow during Valsalva maneuver. Yay! And novel use of 3D Doppler power flow ultrasonography. I got super excited when I read that. If you actually read this, there were only 22 participants who claimed to be recreational athletes, but like, how do you check that? To what level? How consistently were they lifting? We don't know. The majority of the women, 68%, reported a routine participation exercise program. The study made them do a modified bench press with dumbbells. So it was like a slightly inclined bench press. And a lot of past studies, kind of younger studies, I think this was 2021, asked women to be supine just so they can strap something to measure baby-related metrics on their belly. Is nice and convenient, not as convenient as when somebody deadlifts and squats or does a clean and jerk, God forbid. And they asked women to do a 1 rep max. The maximum limit allowed, regardless what women could lift, was 50 pounds. And that was with 4 participants out of 22. Those were the max numbers. I was kind of disappointed how small the weight was. They didn't calculate any kind of formulas in terms of size of the woman versus the weight. The participants were just advised to lift while maintaining proper form without eliciting pain. The 50 pounds limit, it also sounds like a random number, but they claim that it has been defined by occupational literature as the upper limit of the weight considered safe for the general population to lift during the 2nd trimester of pregnancy. Why? If you find any other interesting research that is relevant to pregnant athletes in their 1st, 2nd, 3rd trimester, or for postpartum mamas, please link that down in the comments. I would love to have that as a comfortable space for everybody to share their opinions without yelling at each other. I know this can be a touchy topic and people just resort to the rather safe than sorry advice because pregnant strength training has not been researched enough. Thankfully, we have a lot of endurance information regarding pregnancy, but strength training, not yet. It's only getting popular with women. So I'm going to remind everybody, or I guess update the newbies who are only getting into strength training with the facts that resistance training and strength training increases your bone density. It helps reduce the risk of osteoporosis in women significantly. You have more skeletal muscle, be stronger and more ready for life, while you can scale your training down closer to birth and not have lifting in your life at all postpartum. You're going to have a significant skeletal muscle background to carry you through those points when you would be the weakest in your adult life. Closer to pregnancy and postpartum, I can't imagine a more significant weakening in an instant life event for a woman. A major surgery, I guess, can be compared with that. But do remember that strength athletes have more muscle mass, improved joint stability, better neuromuscular coordination, so we're less likely to fall, especially when the center of mass changes, when you have an increased anterior pelvic tilt during pregnancy because of the belly growing and the center of mass shifting forward and forward. Like, I have lordosis. My lordosis is pretty severe. I also have scoliosis. And knock on wood, I'm on the 8th month of pregnancy right now. My back hasn't been hurting. I've been able to be doing all of the normal things and carrying groceries and helping my parents, in and out of the wheelchair and the car and whatever, just whatever they need to do. Like, I don't even, it's nice when people want to assist in the store and I'm like, oh yeah, I'm pregnant. That's why they're doing it. That's so sweet. But if I'm completely alone, like I don't feel like I'm going to injure myself by carrying a grocery bag from the car to the house. You're going to recover much faster. What is going to recover better? Stronger tissue or weaker tissue? Regarding diastasis and pelvic floor prolapse, we're going to have a different video talking about both of those things. But in the meantime, I do recommend checking out Carrie Pagliano's Active Mom podcast and Christina Prevett's Barbell Mamas podcast. Both of those are, I think, invaluable. They have been invaluable resources during my personal pregnancy. And they are both PhDs, and one is a physical therapist, the other is a pelvic floor therapist. So they can definitely break it down better than I can as a personal trainer and just an athlete. No doctorates, no PhDs. Sadly, training helps mitigate gestational diabetes risk. That has been broken down by many studies. There is a Tingena study of 2023 that you can check out. I also like Dr. Shi's and Dr. Zhang's study of 2024, showing that physical activity in pregnant women lowers the risk of gestational diabetes mellitus by 36%. People who've trained more achieved the best reduction in diabetes mellitus risk. For pelvic floor prolapse, like I said, there will be another video, but I did like the 2020 cross-sectional study by Lori Forner on physically active women lifting weights less than 15 kilograms who have reported more symptoms of pelvic organ prolapse rather than women lifting weights greater than 50 kilograms. And there was no relation with body mass index, C-section, hysterectomy, menopause, or forceps delivery. So that is an interesting one where women lifting more weight have arrived at less prolapse. I have seen some indications in like Mayo Clinic and other resources that heavy lifting in women is a risk factor for having pelvic floor prolapse, but they also listed similar things as like being white or Hispanic, smoking, coughing, constipation, etc. You can look it up. It's like, okay, heavy lifting, smoking. Interesting. There's actually a fresh study of 2025 that indicates that powerlifters engaging in regular resistance training 3 or more sessions a week can safely lift up to 85% of their intensity in early pregnancy without adverse fetal outcomes, provided the intra-abdominal pressure is managed effectively. Unfortunately, there are not a lot of participants. There were only 10 pregnant participants, but they did do the squats and bench and deads up to 70 and 90%, and their metrics were measured at the same time. So fetal heart rate, their blood pressure, glucose, etc. They have also found that Valsalva maneuver was just fine. So there was a lot of disagreement on Valsalva maneuver, and I have tried lifting with Valsalva and without, and have noticed like zero difference, maybe because my weights were light. When I wasn't using Valsalva, I would just try to do diaphragmatic breathing. So, for example, when I descend on my squat, I would slowly inhale, and when I ascend, I would exhale. So I wouldn't hold my breath, and because I wouldn't squat with more than 100 kilos, I have found no difference with that versus Valsalva. Maybe it's like a tad harder, but for a person who could lift before pregnancy, like 180 kilos, I think the significant drop in load made the breathing not very different. The majority of my weight drop was because I didn't use a belt. And the belts is the only thing that I didn't find enough studies on. The Gym Reapers just has an article saying it's probably safe with citing nothing. And I'm like, cool. That's how you're getting people to buy belts. A 2023 study by Skog investigated 47 women who could actually squat and deadlift a significant amount. So 1.2 back squat and 1.5 deadlift, about 75 to 85% of their 1 rep max, and have noticed no changes in their pelvic floor strength or weakness or anything like that. And the women were recommended to race and do a Valsalva. So we're going to wrap the video with this. Let's exchange opinions in the comments. Share your personal strength training stories during pregnancy if you're a mama. Share stories of your clients if you have trained pregnant people and you are a coach like myself. I have trained women postpartum. I'm probably going to share some of their experience in the Diastasis Rrecti video. But this is getting long already. I hope you guys check out the free and affordable resources for strength training, awesome recipes, vegan protein infographics, and of course, courses that are self-guided. They do not need a coach. They just provide you with the best information either for home training or strength training at the gym or both home and gym. And of course, the Vegan Powerlifting Starter Guide on Amazon. I will see you in the next video.